My name is Dr. Tamara Vanderwal. I'm an assistant professor in the Department of Psychiatry at the University of British Columbia. So the long-term goal of this expedition uses functional brain scans to study child psychiatric disorders. So in our scans, kids watch movies while they're inside the MRI, and then we're looking at functional brain patterns while their brains are active and processing all of the information that's in the movie. So I think research plays a major role in helping kids with mental illness. We want to provide actual real tools so that when a kid goes for treatment, that treatment is specific for their needs. We can tell them definitively what they have and help pick something specific for them that's going to help them get better. It's very frustrating right now for kids and families who are sick and who have mental health issues. And so for me, seeing that frustration and seeing where we need to get and then going back to the lab and trying to work on it, I really like that synergy.
My name is Sanjay Kalra. I myself am a neurologist. We are at the Peter S. Allen MR Research Center at the University of Alberta. With the MRI machines, we're doing brain imaging, and we're looking in patients with ALS to see if we can measure the disease that they have, if we can quantify it, if we can see how it changes over time. To better understand what the basis of this variability is, we need to study as many patients with ALS as we can. Prior studies have always focused on examining patients at one center, one city. But if you really want to apply the technology to all patients with ALS, you have to demonstrate that the technology can work across multiple centers. So we built this transnational consortium where we will study as many people with ALS across the country as possible.
I'm Ferguson. I'm the Vice President with the Martin Family Initiative. The Martin Family Initiative is a private foundation based in Montreal that services Indigenous communities, people, organizations, and institutions across the country, working to develop innovative, evidence-based programming that moves the needle around education and well-being. The theme of exploration is at the core of everything we do. So one of MFI's largest programs is called the Early Years, and it is a suite of programming that works to support Indigenous communities and organizations across the country. So everything we do needs to be community-led, and that goes for research. We need to take it out of the White Tower, bring it into communities so that the research ultimately impacts their lives.
My name is Cembrowski, and I'm an assistant professor in the Department of Cellular and Physiological Sciences at the University of British Columbia and an investigator within the Dijavad Moafajian Center for Brain Health. Our research explores learning and memory in the brain. You remember things and I remember things, but physically we don't actually know what those memories are in the brain. Our research matters because memory is who we are and has immense opportunity to help us understand and ultimately treat a wide array of brain disorders and diseases. We are nothing if we don't have our memories of ourselves, our loved ones, our community. But in addition to that, it helps us to understand what happens when things change in the brain that produce disorder and disease, and help us to ultimately understand how we can interpret and treat various types of memory-related disorders.
I'm Dr. Matthew Galati. I'm a traumatic brain injury survivor, a medical doctor, founder of Brain Changes Initiative, and a partner of Brain Canada Foundation. Back in 2013, as a second-year medical student at the time, I was in a very serious car accident, and most critically, I had a head injury, and the backbone of my recovery was really aerobic exercise. So we started the Brain Changes Initiative in 2019, initially as a vehicle to fund these groundbreaking approaches for traumatic brain injury. And we started putting out some of this information on social media and doing some education to the general public, and it really took off. And we kind of evolved into this larger beast where we serve as an avenue of awareness, education, and support for traumatic brain injury patients, their families, and people who just want to live a brain-healthy lifestyle. Brain Canada.
Funding from Brain Canada.
And through this funding from Brain Canada,
Brain Canada has really made this possible.
Highly innovative project possible.
Brain Canada was all in.
and allowed us to not just start this research, but get results that are truly unique worldwide.
They recognized that there was a lot of potential.
And it's always refreshing to see that there are still funding opportunities to help us move forward.
Close to the end of this project, I'll be able to sit there and look at brand new data that's never been seen before and results that haven't been seen before.
And a population that's representative of all of Canada.
We have expanded from one single community in central Alberta to over 20 individual communities in 6 different regions across the country.
We're going to learn a lot about the brain, and in many ways it's going to teach us a lot as well.
That's when we actually feel like explorers.